This webinar is about COVIDend resources, and COVIDend operates with the funding from the Government of Ontario, the UK's National Institute of Health Research, and a number of individual donors. So we're very grateful to those sources of funding. If we go on to the next slide, I'm just going to go through some of the case for doing things differently as we transition from at COVIDend what we sometimes call the sprint approach that many of us used in the first 6 to 8 months of the COVID-19 evidence response to what we now think of as the marathon in that COVID-19 evidence response. This is really important context for the resources that I'm going to walk through, but some of you may have heard me speak about these points before, so I'll be relatively brief. One is the absolutely remarkable number of single studies being published every day. And that's both good because the science is moving very fast, but it also creates a very high noise to signal ratio. So if you're a decision maker, you're every day being bombarded by people bringing you or bringing to your attention the latest study. And I'll come back to why it's important not to start with those single studies, but to focus on the evidence syntheses that bring together all the studies that address the same question. Second challenge is that one-off reviews on long-term and recurring issues are quickly out of date. So, a review about masks, for example, that was done in April is pretty relatively useless now. And depending on how fast-moving the science is, so for some clinical treatments, something that was done even back in October would be considered to be out of date. Third challenge is that many of the reviews being done are what are called rapid reviews, and they in particular, but even sometimes full reviews are of low quality. So in addition to the flood of primary studies, we've also seen a flood of evidence syntheses, and many of the people who are preparing those evidence syntheses are relatively new to the field of evidence synthesis. So we're seeing a lot of people trying to move up a steep learning curve about how to do evidence syntheses to a high quality. Then a fourth challenge is that relatively few of the reviews about interventions provide a great evidence profile that speaks to the level of certainty of the available evidence. So you can have a high quality review, one that was conducted in a way that's very systematic and transparent, but the actual evidence contained in the review is such that we have very low certainty of what we can expect from the intervention. The fifth thing is that too many of the evidence syntheses that we have address the same topics, and I could give you many, many examples. The one that's here is, and we stopped counting a long time ago, but when we were counting, there were more than 200 prognostic reviews. So reviews that identified the characteristics of people who are at greater risk of infection or the greater risk of worse outcomes. And only 5 of those reviews brought together in a single review 5 or more factors. 6 is too many key decisions have no available evidence synthesis, let alone a living evidence synthesis that's updated as new studies are published. And I'm going to be talking about the list of highest priority gaps in our existing suite of evidence syntheses. And then the final is that the small number of living evidence syntheses that exist often address the same topic. So we have 3 of the top groups in the world for living evidence synthesis, all tackling the same question, which is what should we do about clinical treatment? So it's in a way unfortunate that those 3 teams aren't working collaboratively on a single living evidence synthesis and instead are doing the same work in their own environments. So that's a little bit about why COVIDend has reacted in the way that it's done with the resources that I'm going to come to. So this will become a little bit clearer when I get into the resources. Steve, if we can go to the next slide. I'm assuming that most people would be familiar with why we would want to start with recently updated high-quality evidence syntheses, but these are the 4 reasons that we typically cite For those of you who have a statistics background, the first one is about getting the point estimate right. The second one is getting as narrow a confidence interval as possible. But if you're like me and you don't work in areas like clinical treatments, where you often can get to a very specific point estimate with a narrow confidence interval, and instead a lot of the insight from evidence syntheses comes from understanding how findings vary by context and population. Syntheses are still critically important because it's only when we can see all the single studies in one place that we can start to see patterns in how the findings vary by context and population. And we think that's really critical for questions related to health system arrangements and also the economic and social responses to COVID-19. And then another quick point is, rightly or wrongly, a lot of decision makers don't just want to know what the evidence is saying. They want to know what are other jurisdictions, other countries, or other provinces and states doing that they should be aware of. It may not have been evaluated yet, but it might be considered innovative, and so they might want to have access to that information. And again, you'll see that with one of our types of products, we summarize not just the best evidence, but also what other leading jurisdictions are doing. So if we move on to the next slide, this is kind of an overview of the supports or resources that we have for those who are supporting decision making. And I'm going to spend the bulk of the time walking through these, and then I'll turn to some of the resources we have for researchers. And if we have time, we'll quickly go through the website to show you how to find these. But when you first go to the website, you have the choice of clicking on a button that says resources for those supporting decision making, and then this is the menu that you'll see. So I'm going to talk about each of these in turn. So Steve, if we go to the next slide, I have a few slides about the inventory, more to give you context. The best way to make use of it is to go directly to the website and navigate through the different web pages. But as background, we pull the evidence syntheses from a number of sources. So these are what we consider to be high quality, high yield sources. Uncover, which is run by colleagues in Edinburgh, the Veterans Affairs Evidence Synthesis Program run by colleagues in Seattle. Cochrane, of course. COVID-NMA is COVID Network Meta-Analysis. It's led by Cochrane France with many partners. Epistemonikos has a number of resources on its website, including a very exhaustive inventory of single studies. But here what we're doing is pulling their own evidence synthesis products. And then what we call forward. So when we're on many listservs, when we encounter relevant syntheses, we also put them into the hopper. We have two sources of synthesis protocols. So these are descriptions of planned systematic reviews, so Prospero and the National Collaborating Center for Methods and Tools in Canada. And then we have two sources of what we call process syntheses, ones that have already been rated for quality and so on. Well, one is our own in-house at the McMaster Health Forum, our rapid evidence profiles, and the other is the National Collaborating Center for Methods and Tools rapid syntheses. So when they have already been, rated for quality, data the last search extracted, that saves us a fair bit of time. So that's why we draw on those sources of process syntheses. So if we go to the next slide, the inventory, as you'll have seen if you've gone to it, and as you'll see if we have time for us to quickly walk you through it, is organized on 4 different web pages. One focused on public health measures, so that's masks, physical distancing, that type of thing. Second, clinical management, and this is both the clinical management of COVID-19, but also pandemic-related conditions like exacerbations of mental health and substance use problems. Health system arrangements, which is in part how we organize the system to get the right products like vaccines to people now that the vaccines are coming online, but also questions like how do we prepare for and respond to surges in infections when our hospitals become overwhelmed. And then finally, economic and social responses, which covers the full gamut of financial protection, travel and tourism, all of the other parts of society that have been profoundly affected by COVID-19. Then we use the term best evidence synthesis. So for any given decision, you might find 0, 1, 2, 3 syntheses. 0 means we can't find any high-quality synthesis. 1 means we could find one that was the best match to the question. When we have more than one, typically one of two things are happening. Either different syntheses are dealing with different aspects of the decision, or it's the case that they're dealing with the same aspects of the decision, but they vary in terms of our criteria for best. So one might be more recent, but the other one may be higher quality. And best for us is defined by 3 criteria. So how recent the search was, the quality of the review, and whether there's a grade evidence profile. Every review then has a hyperlinked declarative title. So instead of using the title provided by the group that prepared the evidence synthesis, we write our own, and we try to write it in a way that makes it easier for people to scan it and say, yes, that is relevant to the decision we're considering, or no, it's not relevant. So if it's a review about effectiveness, then we try to convey information about what is sometimes abbreviated as PICO, the participants, the interventions, the comparators, or the outcomes, and the certainty level for the available evidence. So if there is a grade profile, you'll often see language like there is low certainty evidence about the effectiveness of cloth face masks, for example. Then we also provide additional decision relevant details, like whether the evidence synthesis is living, and we take the word of the evidence synthesis producer for this. So we do not have our own criteria as yet, but if they assert it is a living evidence synthesis, then we note that. And we now, every single week, go back through the living evidence syntheses that are in the inventory and update the date of search and update the declarative title if the findings have changed since the last time we looked at it. And we also describe the synthesis type, like rapid versus full review, and synthesis question. So, for example, is it about benefits and harms, or is it about values that citizens believe should guide the allocation of vaccines? So if we go on to the next slide, just to give you a sense for how the inventory reduces the noise to signal ratio. So we have now harvested more than 3,600 evidence syntheses. After removing duplicates, we end up with more than 2,600. We then have 1,250 or more in our database. So they were eligible. For example, they are an evidence synthesis. They are relevant to a decision. And then we have 175 in the inventory. So we go all the way down to, you really only need to look at these 175 plus. The rest of them are either lower quality or not decision relevant or something else. So a remarkable reduction in the noise to signal ratio. So if we go on to the next slide, another resource that we provide for those supporting decision makers are horizon scans for emergent issues. And our horizon scanning panel also plays a role in helping us prioritize topics where we most need evidence syntheses going forward. But I'm going to come to that a little bit later in the presentation, those priority topics. For now, what I'll say about our horizon scanning work is that the team prepares a monthly briefing note drawing on horizon scans done around the globe. They then convene a meeting or a panel meeting. I think our current membership is just a little bit over 40. These are diverse, what we sometimes call strategic and out-of-the-box thinkers and doers. And they're diverse intentionally. They've been selected because they are diverse in their knowledge and experiences with different parts of our taxonomy. So some may know a lot about public health measures, some may know a lot about clinical management, others about health systems, and others about different aspects of the economic and social response. They're also diverse in terms of the role that they play. Some are citizens, and we've just added a couple of more citizens thanks to the leadership of Maureen Smith, our lead for citizen engagement. We also have service providers like physicians and others. We have policymakers, and we have researchers. We cover all WHO regions, but we're a bit light in the Southeast Asia region currently, and we cover all major WHO languages. One of the recent things that we've started doing with the panel as well is, in addition to eliciting from them the emerging issues that we need to be paying attention to, we also ask them to prioritize and help us frame in a way that will be most decision relevant the topics where we most urgently need syntheses. And again, I'm going to come back to this a little bit later in the presentation. So that's Horizon Scans. On to the next slide. So a third resource that we provide for those supporting decision makers is essentially an online community of practice where people who are supporting decision makers can share their experiences and also learn from others who are doing similar work. So you'll see some of the attributes that we were looking for when we initially issued the invitation. This is an open community, so of course different people can join, but we're particularly interested in those who are creating and or using evidence syntheses or related products, engaging directly with decision making, and are keen to learn from others, and willing to explore challenges or share experiences with others. And then COVID itself has some principles which we think are important, and we just ask people to confirm that they're comfortable with those principles. So if you are someone who is supporting decision making and you feel that this describes you, we'd be absolutely delighted to have you join the listserv. You can be as active as you want, posting yourself, or you can be what we sometimes call a lurker. I'm a lurker on a number of listservs. I post on some of them, or don't post, or post very infrequently, but I learn a lot from monitoring the discussion. So that's the COVID end community. If we now go to the next slide, a fourth resource that we provide for those supporting decision makers. This was developed by our colleagues at the Africa Center for Evidence, and it's called a living hub of COVID-19 knowledge hub. So living hub in the sense that our colleagues at ACE are regularly updating the hub, and so it remains kind of a source that you can keep coming back to. And what this was created for is to address the reality that many decision makers were asking, well, how do I find an organization that is supporting decision making on topics or in sectors that I care about? And they may also say, well, and I also want a group that maybe focus more on making recommendations, or it may be presenting data, and it may also, they may have a preference for a particular geographic scope. They only want to find groups that are working in Africa or in Latin America, or linguistic scope. They're looking for a group that provides COVID-19 knowledge support in Spanish or in Chinese or another language. So incredibly helpful way to zero in on groups that you might want to draw from and or collaborate with. So the second point there is the depth that is used by the Africa Center for Evidence. So you'll see how they define a knowledge hub. And they've gone through two major releases of the data that are available to search in the online Living Hub. And in the second release, by then they had gone through 440 hubs and 304 met their inclusion criteria. So when you search the hub, you're searching a database currently that includes 304 hubs, and that will continue to grow and change as more hubs come online, and perhaps in future when some hubs retire from activity. So on to the next slide. So some of the additional supports, so some of these were more visible earlier in the pandemic, and an example would be the first one, the guide. So initially, one of the first things that COVIDN did was provide a guide to high-yield, high-quality sources. But now that through the inventory work, we are every week going through those high-yield, high-quality sources, others don't need to do that work. So the guide is a way to say, if you go to the inventory and don't find a match to the question you're dealing with, then you can instead go to the guide and look at other sources that we have found to be helpful. So with our own rapid evidence service that we provide, for example, at the McMaster Health Forum, when we get a question from decision makers and we respond in anywhere from 4 hours to 3 days, the first thing we do is we check the inventory, and then having checked it, if we don't find what we're looking for, we move on to the guide. And when you're going through the guide, you'll see flags for the sources that are already searched by the inventory, so you can focus on the other sources. Some of the other things that we have are some tips for those who are packaging evidence for decision makers. So this is based on a lot of experiences in how to do this effectively. We also describe the evidence support model that I just mentioned. So if you are part of a response team trying to support decision making and want to see a description of how one group has responded to support national or subnational decision making, and do it in a way that contextualizes the evidence for those decision makers in that context at a particular moment in time, this may be helpful. And the model involves producing these rapid evidence profiles. So it's not a synthesis. It doesn't say, here is the bottom line message. It is a profile of available syntheses, or in their absence, single studies that may be helpful to you. And those rapid evidence profiles, as I alluded to before, profile both research evidence and what innovative jurisdictions are doing, but where they may not yet have evaluated their efforts. And then finally, there are some tips and tools for those supporting decision making. So that's the current array of resources available for those supporting decision making. Steve, I'll just check in with you. Have there been any posts in the chat box so far about this part? Otherwise, I'll switch gears and then we'll open it up for discussion at the end.
No, there's not been any, but I would be able to use the chat box and the share comments during the webinar and get that at the end.
Exactly. Great. So, Steve, can we go on to the next slide, which now I'm going to switch gears to resources for researchers. So the first thing is the priorities for living evidence syntheses. So I alluded to this when I was talking about the work of the Horizon Scanning Panel. So they help us identify emerging issues. So this past month, of course, the big focus was a whole array of decisions related to vaccine rollout now that vaccines are on the verge of being available. So that was an example of a set of emerging issues. But over time, they have helped us build up a list of topics that we then check against the inventory to say, well, do we already have robust evidence for that? So an example would be at an early meeting, they may have said, well, we need to know the safety and effectiveness of different drug treatments. When we go to the inventory, as I mentioned before, there are 3 groups in the world running living meta-analyses of drug treatments. So that is covered off well. There is not a need for more living evidence syntheses in that space. But for an array of topics, we know there are important decisions to be made, and we don't have any best living evidence syntheses that we can turn to. So I'm going to run through the current list, which we'll be posting on our website later this week. And at the end of the list, I'll walk you through the tips for teams that might want to put up their hand to take on one of these topics. And then my last slide will be supports for evidence synthesizers. So I'll just walk you through that as an additional resource. And then one that we hope will be up within about a week are supports for guideline developers. So these are both specific to COVID-19. So obviously there are many resources out there if you're synthesizing evidence or developing guidelines, but these are how do you do that in the particular context of COVID-19. So Steve, can we move on to the priority topics? So these topics are organized by those 4 parts of the COVID-19 taxonomy that I've referred to repeatedly: public health measures, clinical management, health system arrangements, and economic and social response. And the horizon scanning panel helps us with the prioritization within each of these domains. So in any given month, topics might move up the list, and they also, depending on what's been added to the inventory, they might move off the list because we now have best evidence syntheses on those topics. So if you just scan the public health measures, a big focus of decision makers on how do we support adherence to public health measures like physical distancing, wearing masks, a big interest in test, track, trace approaches, particularly how do you optimize them given your current capacity in the system. So there are times where contact tracing isn't possible. There are so many new infections that the tracing system gets overwhelmed. So how do you manage that? Third relates to capacity within public health units and their linkages to the broader health system. Fourth, the emerging recognition of the greater geographic dispersion of COVID outbreaks in wave 2. So in wave 1, they were often quite concentrated. In wave 2, they're often much more geographically dispersed. So understanding why, but also understanding how that changes how we need to respond to COVID-19. And then building rapid response mechanisms to support things like outbreak studies. So when we have outbreaks, how do we quickly learn from them in ways that can help us with future outbreaks? For clinical management, I mentioned that questions around drug treatment and soon the safety and effectiveness of vaccines are well handled, or in the latter case will be well handled by living meta-analyses that are ongoing by those different groups in the world that I mentioned before. But some of the clinical topics for which we don't have living best evidence syntheses, or at least don't have them addressing all facets of the relevant decisions, those are long-haul symptoms of COVID-19 among people without severe COVID. This is sometimes called long COVID. Understanding COVID as a syndemic. So often the people experiencing COVID-19 infections also have other infectious diseases or other chronic non-communicable diseases. And so their experiences are complicated by the co-occurrence of COVID-19 and a number of other conditions. Third, the concurrent management of COVID-19 and other seasonal infections. So how do we deal with people walking into offices and hospitals with chest infection? It could be a regular pneumonia, it could be a regular flu, or it could be COVID-19. How do we help clinicians with that? And then screening for and managing emerging mental health and substance use issues. So now if we move on to health system arrangements, as I mentioned this month, the month of November, the big focus for the Horizon Scanning Panel was vaccines. So a massive set of decisions will need to be made in the coming weeks and months about how we allocate vaccines, how we communicate with the public and address misinformation about vaccines, how we actually administer them. So how will we get 2 doses of a vaccine into most people's arms in a timely way, given many of the current vaccines being considered require what's called an ultra cold chain. They need to be kept at very, very cold temperatures right up to just before the doses are administered. And also reporting. How do we link vaccine data, both the fact that people are vaccinated, but also adverse events, to existing information systems, including COVID-19 apps when appropriate. I won't go through all the others, but you'll see opportunities to, as we respond to COVID, try to strengthen health systems, not steamroll them with kind of vertical programs, so strengthening governance, leveraging primary care. You'll see other comments around keeping health workers motivated and safe, but also addressing shortages when high numbers of them become infected. Restoring non-COVID services after lockdowns where hospitals have had to try to empty their regular cases to deal with an influx of COVID patients, and then strategic purchasing, packages of responses, and then trying to consolidate the gains that many countries have achieved because of the need to move to virtual care. And then finally, economic and social. This list is particularly long. When you get to the inventory, one of the really frustrating things is we have so few best evidence syntheses for the array of economic and social responses to the pandemic. So I won't read through these, but you can scan them and see issues related to financial security, vulnerable populations, the operations of schools, concerns around food poverty, concerns around countries reaching what are sometimes called fiscal cliffs and potentially getting into debt traps as countries went with the significant amounts of money being spent on COVID-19. And then on to the next slide. You'll see some others, tourism and travel for countries like those in the Caribbean, for example, absolutely essential, gender-based and domestic violence, and the list goes on. We also, this month, began to think about whether there are cross-cutting issues where you need to think in a more holistic way across the taxonomy, and the example that you'll see here has to do with equity. I'll come back to equity in a second. So my penultimate slide, the next one, is the tips for teams. So if you are a researcher who has experience with evidence syntheses and you see one of those topics and you say, hey, I would love to build a team to prepare and maintain a living evidence synthesis on one of those topics, these are things that have come up from our Horizon Scanning Panel deliberations that you might want to keep in mind. So in addition to thinking of equity as a cross-cutting issue, anytime we approach a particular issue like supporting the wearing of masks and physical distancing and so on, bring an equity lens to that, because often our capacity to adhere is profoundly influenced by our need to work, by our incomes, by a variety of other factors. Second, always think about, in the early days of COVID, we were very focused on doing the public health measures because of their benefits, doing things like closing schools, but we're now much more attentive to weighing those public health benefits against the potential costs to things like educational outcomes for kids. And then think about government capacity as another key variable. So what a country like China can do with its approach to data collection is very different from what another country like Canada might be able to do. So this is capacity in the sense of both administrative capacity, what can we do, but also political capacity to pull off some of these things that are being considered. Other things to keep in mind, interdisciplinarity. So COVID and most of the COVID decisions are really complex, and ideally you want people coming at the evidence from multiple different perspectives, including having citizens around the table to help interpret what the science means. And then finally, if you are going to take on an evidence synthesis, please don't do a one-off one. If it's one of these high priority topics, set yourself up from the beginning, ideally to make it living. So Steve, I think the final slide is the resources, the supports for evidence synthesizers. So remember, the one for guideline developers will be coming online hopefully within a week. But if you go to the supports for evidence synthesizers, could we just go back? You'll see an interactive flow diagram. You'll then see a description of the importance of really understanding the issue or decision to inform. And our horizon scanning panel, again, has been incredibly helpful in helping us to frame issues that would enhance the decision relevance of any resulting synthesis. And then you can navigate through, once you know what the issue or decision is, how do you look to see whether something's already out there that you can just use? And that would be the case for things in our inventory. Or do you need to update an out-of-date review? And if so, how would you approach that? Or do you actually need to conduct a new review? And when on the website, you'll see then there are a series of steps where the authors of this material walk you through the COVID supports that are specific to conducting a new review in this context. So, Steve, I think the last slide is just the website. So why don't I check in and see if any questions have come in, and if we have time, we'll quickly walk you through the website to make it absolutely clear where all of these things can be found. But Steve, have any questions come in that I can answer?
There is one. Again, I would just encourage people to ask their questions in the chat box. The one question that's come in so far, John, is asking whether there is any particular online training that you offer to public members to become more familiar with the resources of the system. For example, like Cochrane training for consumers, or does McMaster or COVIDend, or I guess any of the COVIDend partners have something similar?
So great question. So far, what I would say is the best resources that are targeted at citizens are on the Cochrane website. So we probably need to do a better job on our website of pointing to those. So with the citizens that we have recruited to COVIDend, so again, under Maureen Smith's leadership, we now have citizens sitting on our partner steering committee. We have them sitting on the horizon scanning panel. We will soon have them sitting on our different working groups. And one of the suggestions that we made in the onboarding session is they take advantage of these amazing free resources available through Cochrane to get background on evidence syntheses if they're not used to it, to an array of issues that if they have the time to spend using these free online resources, it would enable them to contribute even more in our discussion. So right now, I would point to the amazing Cochrane resources as kind of the first stop, but we will absolutely keep this in mind and work with Maureen and her colleagues to better profile these and other resources available through COVIDend partners on the website going forward. Great. Thanks, John. There's no other questions right now. So, okay. So could we pivot? Yeah, that would be great. So what we'll do is we'll just quickly navigate around the website just to help you understand where these different things are. So when you first come to the website, you'll see that second box from the left, resources to support decision making. That is where the bulk of what I have talked about is. And Steve, if you can just go to the box to the immediate right, the resources for researchers, that's the second set of resources that I walked you through. So if we start back with the first set of resources for those supporting decision making, I have to expand my screen. The first is the inventory of evidence syntheses. So you'll see in the menu off to the right, if you want to know more about the context for the inventory and the approach we use, you can go to those pages. Then there's also tips for using the inventory, and we have a superb document we'll be linking to shortly, prepared by our senior advisor, David Tovey. I've been the rate limiting factor in getting that up, but it will be added. And then you'll see the 4 web pages for each of the parts of the COVIDend taxonomy. So if we click on public health measures, and if you just scroll down a little bit, Steve, you first see this version of it. Steve, can you just click on show hide columns to show how when you click on that, you get the additional columns of living evidence synthesis, type of synthesis, and type of question. So moving from left to right, you have the decision, so washing hands, wearing masks, and so on. Then you have the date of the last search, and unfortunately, these these absolutely critical topics that we kind of take for granted are most decisions based on them are based on syntheses that are now actually remarkably old. You'll see dates there, April and May. Then you'll see the quality rating. Then you'll see a note about whether it has an accompanying grade profile. Then you'll see the key findings. Those are the declarative title. Then you'll see whether it's a living evidence synthesis and so on. And then you have the citation. So that's the living evidence synthesis. And if you just scroll down, Steve, people can get a feel for the types of decisions we cover. So wearing personal protective equipment, disinfecting surfaces, physical distancing, public focused behavior change supports, and so on. Health worker and essential health worker support, service limitations, but we deal with those wherever they're appropriate elsewhere in the taxonomy, screening, and then on to testing, quarantining, isolating people. If you're confirmed tested, sorry, I thought we'd pass testing, there's testing, and then lower down, speeding results, isolation, contact tracing. Yeah, so that just gives you a feel for the public health measures. Steve, maybe if you could just click on clinical management. Clinical management is a very long table because there have been so many potential treatments that have been looked at. The top of the table, you'll see the prognostic factors, but lower down once we get into the treatments. First, you'll see the all drug comparison. So where people have started to do a network meta-analysis, you'll see the overall comparisons, and then they go category of treatment by category of treatment with every relevant comparison. So the most recent big topic was remdesivir, a drug treatment, and so you'll eventually get to a row that is specific to remdesivir. So Steve, maybe we'll leave the inventory at that. People can explore that. Could we go back up to the menu? So the next is the horizon scanning work. So if you want to keep up to date on this, if you just scroll down every month, the meeting materials are posted, usually within a few days of the last meeting. So the group usually meets, I think it's the last Wednesday of every month, and then we try to get it out by early the next week. So for our meeting on November 5th, you'll see the briefing note, and you'll see the panel meeting report. So that's the horizon scanning. Then Steve, can we just go back up onto the community? So if you're interested in joining the community, just scroll down and you'll see in bold, join the COVID-N community listserv. So that's the place to sign up if you want to share your experiences and learn from others about how to support decision making. Then back up, Living Hub. So you'll see background on it, and then you'll see the searchable database. So on the right-hand side are I think there's, as I mentioned before, 304 centers. So they all start off on the right. And then as you either enter search terms or click on filters, it immediately narrows the listing of hubs to those that meet that criteria. So if Steve just clicked on public health measures, so now we're getting a shorter list of the hubs that are the ones that specifically deal with public health measures. But you can also add in other things like geographic scope. You only want ones that are focused on country level, regional scope. Might be that you want to focus in on a particular region like Africa. So it's very easy to narrow in specifically on the knowledge hub that is most relevant to you. So back up to the menu. The last piece is the additional supports. So you'll see off to the right the guide, the evidence packaging resources, evidence support model, tips and tools. So maybe we'll just go to the guide and that'll be the only other page we'll show you from here. So if you scroll down, you'll see sources organized in major sections, and you'll see a green flag COVID-end inventory. So if you look at sources of living systematic reviews, the VA evidence synthesis program we have there, because for a long time, and really other than the COVID-end inventory now, they're the one group out there that flags living evidence syntheses. So that's hugely helpful. And when we first set up the inventory, those are the evidence syntheses that we process first. And then lower down, you'll see Cochrane is covered in the COVID-end inventory. So is the Uncovered database. So is COVID-NMA, and so on. So anything that's not covered, if you can't find a relevant evidence synthesis in the inventory, you can come here and click on any of these other sources and quickly search them to see if there's relevant evidence that you can use. So that's the guide. Steve, could we just pivot now to the resources for researchers? So I mentioned that the first of those parts of the menu, the first part of the menu, priorities for new syntheses, that's the piece that we'll be adding in the coming days. Should have been done for today. My fault again. Too many things going on a computer that's not working, but it should be done by the end of the week. The thing that's up is the supports for evidence synthesizers. So Steve, if you can show that. So one is the interactive flow diagram. So you can use this to navigate around. So it's meant to help you see the big picture of the resources for evidence synthesizers, and then having seen the big picture, you can use it to navigate around the resources. So you can either use this, or you can go back up to the menu and say, okay, I specifically want help. I've looked, there's nothing out there I can use right now. I can't find even an old low quality review that I can update and improve the quality of. I'm gonna have to do a new synthesis. So that's where you get this longer list. Okay, how do I identify the question? How do I assemble an appropriate team? Can I use some digital applications and involve people, volunteers around the world? That's the crowd piece. How do I register the protocol? How do I search best sources of primary studies? And how do I conduct and report the review using robust methods? So all of that is sitting there. This, of course, draws on years of work by Cochrane, Campbell, many other groups about how to do high-quality evidence syntheses, but here it's contextualizing it to COVID. So at each step, if there are COVID-specific supports available, it points you to those to ensure that you're building on the best of what's out there. So that's a quick run-through of the resources. I'd encourage you to explore the website. If you have feedback for us about how we can do better, like with the example of profiling citizen-targeted resources, let us know, and we're certainly always open to feedback. So that's the quick run-through of the website. Steve, can we check in if there are any other questions? Otherwise, we'll move to wrap up. Steve?
Yep, sorry, I was just checking. There's one other question. Is there a document that describes how the taxonomy of public health measures were defined?
No. So we at one point had a very detailed set of documents related to the taxonomy, but that has not been kept up to date because the process, in a nutshell, I can describe the process, which was in the very early weeks when COVID was first kind of exploding, we went through an effort to come up with a mutually exclusive, collectively exhaustive list of decisions. So that was done by reading and intentionally trying to find different sources that would help us build out the taxonomy. Then we consulted with a number of experts across the different domains to figure out what we needed to change and adapt and so on. And then having landed then on a working taxonomy, we've used that going forward, and now we make ongoing adjustments as we encounter best evidence syntheses. So we might get an evidence synthesis where we suddenly realize, oh, we don't have a row for this, or the way that the row header, the decision, is framed doesn't actually align with what the real issues are. So we're continuing to adapt up front. It was based on this effort to be mutually exclusive, collectively exhaustive, and to draw on existing frameworks and other sources to build it out. And now it's being continuously adapted based on what we encounter in the literature. So again, if people have suggestions for how to strengthen it, we're certainly open to making adjustments as we go. Anything else, Steve, by way of questions?
No, that's all the questions for now that have come in, John. I'd just like to thank everybody for joining us today. And I just wanted to mention that for our COVID End webinars, we will be hosting these on a monthly basis going forwards. So I would encourage you to check the COVID End website. There is a page on there for our webinars, and when we have the details for the webinars in the new year, they'll be posted and updated there. So we hope you'll join us for our future webinars, and thanks for a great presentation today, John.
And Steve, could I just check one thing with you? Am I right that you're recording these and you'll post the link to the recording? So if people want to go back or want to bring a webinar to people's attention, they can find the recordings on the COVID End website?
That's right. So the same events page where all the details about future webinars will be available. We'll make sure that a link to the recording from today's webinar is available there. So again, if you missed part of it or want to go back or you want to share it with colleagues, it'll be available there. So we hope that everybody takes advantage of that as well. Great.
Excellent. All right. Thanks, everybody, for joining us. And thanks, Steve, for troubleshooting with my failures to be able to use my laptop.
It was a pleasure. Thanks, everybody, for joining us today. And we'll talk to you, or we'll hopefully have you join us again soon.
Thanks. You. Bye-bye.